Efficiency through preparation, I think that's quite important. Some might say self-explanatory, but I still like to go into it. On the left side, you will see an example case. It's not always this complicated. Often it's more complicated even, but often it's just a patient, a facilitator in a hospital, or a patient in a hospital directly. But still, let's look at this case. We have a patient, his medical treatment is going to be sponsored by the respective sponsor, who contacts facilitator A in country. He's contacting facilitator B outside of the country, and he's going to be in contact with the provider. So you have many levels of information flow, and there's risk. You can lose data in transmission. There's a lack of transparency because you don't know if what's being communicated is actually presented to the patient in the form it was initially done. So there's planning errors. There's planning errors just to use simple times as time shifts. The patient is speaking about CET time, and the doctor is speaking about the other time zone, and sometimes these things actually tend to happen. And there's no direct account from the patient. The doctor often has never spoken to the patient. He has never heard him say, this is what I feel when it comes to pain. This is what I feel when it comes to discomfort. And this is where telemedicine can help solve this issue. So using telemedicine does not mean bypassing facilitators, by no means, but offering the patient to speak to his doctor directly. You can still maintain the function of the facilitator, but at the same time allow all entities to have a better experience. Continual patient-provider relations, something that's very important. Most facilitators in hospitals have understood that the patient's journey doesn't end once he has traveled back to his home country. So there's 3 key elements: pre-arrangement, preparation, follow-up, and visit. But continuing to provide care during even times like the pandemic, where patients haven't managed to come into the hospital due to travel restrictions, showing them you can still rely on us, we are here for you. And this is one of the most important elements. And I have done so myself. I've communicated to our hospital clients at the earliest stages of the pandemic: go out, contact your patients, let them know whatever they need, you will try to help them. Even if they cannot travel, you will facilitate telemedicine consultations. You will assist them in procuring medicine. And this was hugely effective because patients understood there's somebody in this different country that's caring for me. He's really thinking about how I feel and how my comfort is developing during this time. And even though I cannot benefit them in terms of financial benefit because I cannot visit them, they are still willing to show me support. And I think providing means through technological means is really a must. And Dr. Reda also mentioned very nicely, it should be also implemented maybe in the curriculum of medical professionals to make them more aware and more skilled with using these technologies. And again, we end up with a long-term patient-provider relationship because you see there's a person and institution of trust that is caring for me. So provider centricity. We hear a lot about patient centricity, and it's still number one, but provider centricity is something you should think about. It goes hand in hand with the idea of getting all solutions from one actually hand. Again, patient centricity shall remain at the core, but the idea that's now developing in medical tourism is you have the provider in the middle, and he's able to provide everything. He's able to provide you with medical care, first care. He's providing you with the pre-arrangement. He's doing the follow-up, and he can also take part in family medicine, in a family medicine setting where you have your own private personal doctor outside of your country for whatever reason, if you wish to do so. And I think there's also this approach is going to be much bigger in the future. We see it now, clients from the Middle East requesting to have a family medicine provider in Germany, because there's different models in all nations, different models for medicine in Germany, and they heard of this model and they enjoyed this model of you having one family medicine professional. You are going to visit him, your whole family is visiting him, and he's coordinating for you. And in the future, providers, they are now starting, and I would urge everybody to try to develop in the same role. And if there's a medical specialty you cannot cover, don't be afraid to refer the patient to somebody else. But once you have this relationship of trust, it's much easier to continue treating the patient. And also by referring him, you show that you're not only interested in basically keeping him as your client in the sense of the business, but actually you are again caring for his health. So telemedicine allows providers to offer long-lasting care, which is key in a comprehensive medical tourism strategy. The key takeaways, quickly, we start with the patient experience, patient centricity. The patient should be treated well. He should have a grand and a good experience. You should try to take the discomfort out of the situation. Prioritize the long term over the short term. Again, and I will repeat it many times in the future, because it's so very important, not only in healthcare, but especially in medical tourism, where often there is a short-term thinking on behalf of facilitators, on behalf of hospitals, on behalf of destinations, even cities, that only want the medical travelers to come for the season to spend their money. And we have to be frank about the situation, and call it as it is. And this is, again, where transparency comes in, offering all the knowledge to the patient, all the possibilities of how things are going to develop, and thus providing security to him, and also comprehensivity. If you are able to offer many services with the patient, do so. Position yourself at the core of his health and be his assistant now, in 5 years, or in 10 years. That's it. Thank you very much for your attention. I'm looking forward to your questions. If we have any in the chat and the Q&A, I would ask you now to ask them. I will have to pick them out myself, so let us see what I have here. So we have a question. How can we control the misleading information and medical knowledge is given to patients for collecting data from different clinics, ending up losing the patient's trust? Okay, I try to make sure that I understand your question correctly. So in case you're speaking about a patient contacting multiple medical providers and getting differing opinions, it depends on what role you play in this chain, in this process. And maybe Dr. Hassan, you can just let me know if this is what you meant. You should position yourself in a way that you can offer him certainty. There is no certainty in medicine, but by collecting these differing opinions and trying to find an expert who is versed in citing second opinions and in writing statements for these opinions. So I would urge you to pick a few specialists in this area, but at the end of the day, often what's needed is follow-up examinations just in country to ascertain what actually is going on. And also one important thing, that patients do not, they don't have the courage to do so. But if you get 2 or 3 different opinions for the same set of medical information, I would urge every patient, and the facilitators and hospitals should act as a medium to support this, to ask the hospital straight ahead. We have 2 opinions. One is saying A, one is saying B. Can you kindly justify why what you have written is actually correct and why what opinion B states is not correct? And this is the duty of the facilitator, but also hospitals should aid in this process by ensuring their patients. And also, in case there has been a mistake made, definitely admit that maybe there was a mistake. Often it's really the quality of imaging that is shared. We have seen many cases from the CIS where patients come and they have been told in their home country, you actually have a tumor, and you actually on the X-ray or any other kind of visual diagnostics, there is something visible. And once they do the diagnostic examination again in country, you will see there's nothing. It's just error or defect in the machine that was used. And I would not say this if it happened quite often from patients in the CIS. And so there's also virtue to admitting that you have been mistaken. I hope this answers your question. How can we help patients in availing telemedicine facilities, those who are not tech savvy? I mean, there's the older generation. I think it starts by, this is a bottom-up approach. Start by the younger generation, provide them for people who grow up with these technologies. And yesterday, I forgot which speaker it was, I think from Esther DM, he mentioned we have this Insta culture. You are used to pressing a button and getting what you need, be it food, be it entertainment. And that's a generation who's used to it, and provide them with this service and thus give them the opportunity to teach their elders and even support their elders. There's people just for physical reasons or for cognitive reasons, they cannot use these technologies. But if you teach the younger generation and make it a real option for them to use these technologies, to use telemedicine, you can definitely go a long way in bringing it to, let's say, the less tech-savvy patients. And we should also not forget, it has to do with personal opinion, the way you grow up, some people will not trust a doctor who they cannot touch and a doctor who cannot trust them. They want somebody to be there to touch them, to do a physical examination. And this is something I think COVID has changed, because there was no option to do so. So they would have to use the second best option. And this changed some minds, but at the end of the day, you cannot change all the minds. But it's one approach is to go through the younger generations, and another approach is also to go to medical providers and tell them, use this technology and provide it to your patients. So if there's not any more questions, I'm glad to see that I've answered your question the way you asked it, Dr. Hassan. Thank you. I wish you all a great day ahead. I will accompany you on the journey of the next amazing speakers to come. And the next one is going to be my dear friend, Dr. Prem, at 1 a.m. and 10 after 1. So looking forward to see you all there and talk to you soon.